Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Hello and welcome to Healthy Conversations. We're going to be talking about high blood pressure. What you don't know may harm you. I'm Dr. Olufunso Odunukan, and I'm one of the cardiologists here at Dignity Health, Yavapai Regional Medical Center. I specialize in minimally invasive treatments for valvular heart disease, as well as non-surgical treatments for coronary artery disease. I trained at Mayo Clinic in Rochester, Minnesota, with my cardiology training done at Mayo Clinic in Jacksonville, Florida. My interventional training, as well as structural heart disease, was completed at Scripps Clinic in La Jolla, California. What is high blood pressure? What are its symptoms? What causes high blood pressure? What do the blood pressure numbers mean? We know that there's a number up top and a number below, but what exactly do they stand for? Why is high blood pressure dangerous? And how can we prevent and treat high blood pressure? Blood pressure is the force that's generated when blood is pumped through the arterial walls by the heart. As we grow older, our blood vessels stiffen with age, and the heart works harder and less efficiently to move blood through the vessels, and our blood pressure gradually becomes higher again as we age. Why is high blood pressure dangerous? The reason is most people with high blood pressure, or hypertension as it's called, do not have any symptoms. And for a significant number of people, it is when they have complications of high blood pressure that they are first aware that they've had hypertension for a while. And usually those events include strokes, heart failure, or kidney failure. When people with high blood pressure have symptoms, it's an indication that their blood pressure is extremely high. And those symptoms can include severe headaches, nosebleeds, fatigue or confusion, vision problems, irregular heartbeats, or when the kidney is involved, you can have things like blood in the urine, as well as other symptoms such as difficulty in breathing or even chest pain. Untreated high blood pressure, as we stated before, can lead to significant heart disease, heart failure, and sometimes even heart attacks. Regarding the brain, you can have complications including stroke when it happens acutely, or with people who've had high blood pressure over time, in their old age, they can be prone to dementia. The kidney is also a vital organ that's affected by high blood pressure. And so it is not uncommon that people who have suffered with high blood pressure and have not known about it can end up with kidney failure. A good way to look at this is to imagine you're in your garden watering your flowers using your garden hose. If you're close to your flowers, you don't need to make any adjustments to your hose. But the farther you go from your flower beds and you still want to be able to sufficiently water the flowers, one easy trick is to narrow the opening of your garden hose, and that shoots out the water with more pressure. Similarly, as we grow older and our blood vessels become less elastic, blood flowing through flow at a higher force. And many of the organs that are end organs, like the brain, the kidneys, and the heart, where blood flow stops, usually take a pounding from the pressure of the blood. And that's what ultimately results in significant damage to those organs, like kidney failure and stroke and heart failure. What do my blood pressure numbers mean? In general, when you're told about your blood pressure by a health professional, they will tell you about two numbers: a numerator, which is the number up top, and a denominator, which is the number below. The numerator stands for your systolic blood pressure, and your denominator stands for your diastolic blood pressure. When your systolic blood pressure is at or above 140, and that's the threshold at which a diagnosis of hypertension is made. We typically say a normal blood pressure should be 120 and below. So between 120 and 140 is pre-hypertension. Actually, precisely, it's between 130 and 140. That's considered pre-hypertension. And for the number below, and any number above 90 is considered diastolic hypertension. So either one of those numbers is enough to make a diagnosis of high blood pressure or hypertension. And these numbers and categories become important when we talk about treatment. For people who are in the pre-hypertensive phase, they do not necessarily need medications, but that is the point where we get the biggest bang for lifestyle modifications, such as weight loss strategies, dietary changes to include less salt intake, lower cholesterol, meals with lower cholesterol content, and changes such as increasing physical activity, exercise, things like walking every day, or even joining a gym. Those changes at that stage make a whole lot of difference. But once a diagnosis of hypertension is made, in addition to those lifestyle changes, it is very critical to start medications in order to keep the blood pressure down. And what's important to know is that in a small proportion of cases, it is possible for the high blood pressure to completely go away with lifestyle changes. People who are obese or weigh a lot, we found out that after they've made significant changes and they've lost a significant amount of weight, their blood pressure improves, and to some extent, their hypertension can reverse itself. But in the majority of cases, most people will require some degree of medications to keep their blood pressure under control, which is why it's important to stay on medications and not stop them without the advice of your cardiologist or physician. So what steps can we take to prevent high blood pressure? A lot of those things we talked about in the pre-hypertensive phase, when instituted early, can actually allow us to stay in the normal blood pressure range, making sure that we maintain good dietary habits, foods that are low in salt content, foods that have low cholesterol content, making sure that we have a regular exercise routine. Doesn't have to be anything complicated. Just eat something as simple as a 30-minute walk every day, I would say would go a long way. And if you have the wherewithal to have a gym membership or to have something at home, the important thing is to have a sustainable and practical exercise routine. Maintaining an ideal body weight is very critical. In our population, obesity is on the rise, and because we don't have access to good exercise facilities or even simple things like walking, now that most families have at least one or two cars between them that takes them everywhere, the opportunities we used to have for exercise are greatly diminished. But it's important to make sure that we maintain our ideal body weight. And for a number of people, weight loss strategies may even be important, either medically or even surgically, things that include bariatric surgery. But an ounce of prevention is worth a pound of cure. So it's better to take these steps because ultimately it's cheaper and more effective in the long run. In addition to lifestyle changes, it is important to recognize the role medications play in the management of high blood pressure. As the blood pressure numbers go up, we may need higher doses or increasing numbers of medications to be able to get these blood pressure numbers back within the normal range. Blood pressure medications fall in different categories that target different mechanisms in the body. And finding the right medications that work for you may take some time. And once we find that combination, it is important to stay on the medications and not discontinue your medications without the advice of your medical provider. We cannot emphasize this enough because a lot of people, after a while of them taking their medications and having their blood pressure staying in the normal range, they start to believe that they are cured and that their high blood pressure has gone away. And in that case, it's not uncommon to find people discontinue their medications without the knowledge of their healthcare providers. It's important to recognize that high blood pressure it very rarely completely goes away. What the medications and the changes do is to keep you in the normal range. In the absence of those, it is very likely that the blood pressure will start to creep up. In recognizing the significant damage that can be done to critical organs in the body like the brain, the heart, and the kidneys makes it important to ensure that you stay with the treatment strategy that has been designed by your medical practitioner, which typically will likely be a combination of medications and those lifestyle changes we emphasized earlier. Thank you for your attention. It's been wonderful talking to you about high blood pressure and emphasizing that what you don't know could sometimes kill you. I'd recommend that every once in a while you stop by your local pharmacy or the Walmart and have your blood pressure checked. And if there's any suggestion of anything out of the ordinary, feel free to get in touch with us here at the Cardiology Group at Dignity Health, Yavapai Regional Medical Center. We're always here to partner with you to give you the best health and to improve your quality of life. Now we will take some questions. In some groups of people, hypertension or high blood pressure can be hereditary. And so that's something to bear in mind. If there is a family history of high blood pressure, then that person can be at risk. There are multiple things that can be done for people with refractory hypertension, which is a term for high blood pressure that's difficult to control even with lifestyle changes and medications. In that case, we will need to make sure that the secondary factors or causes are being adequately addressed. For people with obesity, it is not uncommon for them to have sleep apnea. And in this case, it takes a full sleep study to diagnose it and to have devices or therapies to make sure that that's treated. For people with sleep apnea that's untreated, their airway seals off in the middle of the night and they have trouble breathing. That puts a lot of strain on the heart and it's going to make it very difficult to control their blood pressure, even with medications and lifestyle changes, until those additional issues are addressed. There are things that are coming up in the works for such patients that may be interventions that could potentially be done, procedures that could be done to treat refractory or difficult to control high blood pressure. There are procedures in the works that are still undergoing rigorous clinical trials to establish their role in the management of high blood pressure, especially hard to control high blood pressure. One of these procedures is called Renal Dinavision. That's a procedure where we'll use instruments to essentially strip off the nerves that lay on the kidneys that play a very significant role in how our body adjusts and maintains the blood pressure. That's not prime time yet, but in a few years, I'm fairly confident that this will become an important instrument in our armamentarium for the treatment of extremely difficult to control high blood pressure. Thank you for your attention. Appreciate your time. And for more conversations like this, visit yrmchealthconnect.org.